Welcome to the Sporty Dietitian Podcast, a show that helps you simplify your nutrition and amplify your activity. I'm your host, Sarah, a board-certified sports dietitian, personal trainer, and expert in sports nutrition. In today's episode, I'm going to give you 5 fundamental differences between a dietitian and a nutritionist. Let's get into it. Number 1, the first big difference between a dietitian and a nutritionist is education. Frankly, anyone can call themselves a nutritionist. There are certification processes that one can go to, especially if they do value that certification. There is value to getting those things, but the extent and depth that a certification versus an actual formal education provides is much different, right? And so when we're talking a nutritionist, really we're talking no formal education required to be a nutritionist. And the main reason for that is because the term nutritionist is not regulated. There's no formal definition as to really what a nutritionist does or is. There's no scope of practice that's outlined. And then when we talk about a dietitian, which is what I am, there is very much a formal education process that one must go through. First and foremost, you have to go to a 4-year accredited university. So you can get a degree from a college, but it must also be accredited by the governing body for the regulation of what an accredited university is. And there are specific requirements that you have to meet as that university, and accredited universities can become unaccredited. Unaccredited universities can become accredited. So ensuring that you are attending an accredited university is the first step to become a dietitian. And you can easily find that information either in the dietetics program for the specific university, or you can go to the Academy of Nutrition and Dietetics website, and they will actually tell you what universities are accredited. After you do 4 long, hard years at a university and earn your bachelor's degree, then you must go through a really minimum of 1,200-hour internship. So that roughly equates to 1 to 2 years, depending on the university that you're at. Some universities do 1 year and you just get your dietetic internship certificate. Some universities do 2 years and you also get your master's degree in the process. When you're in this internship, you are almost treated as like a resident in after medical school and doctors go through residency. You are kind of figuring out what real world experience looks like, and you're in different areas of nutrition, of healthcare. So that typically includes clinical and acute care settings, large hospitals, maybe you're in a rehabilitation hospital, clinic settings and things like that. You're hands-on working with patients. You can also rotate throughout your internship in community settings. So now we're kind of talking the outpatient world, WIC clinics, and in other areas in the community. This also includes private practice. And then lastly, you have to hit a food service setting. Even if you are interested in the community world and you don't ever foresee yourself working in food service, you do have to do that food service rotation. Depending on the specialty areas of the internship, that determines like how long that specific rotation was. At my internship, my food service rotation was 9 weeks. That's a little bit longer than most, but my internship had a community focus. And so we spent a lot of time out of the acute care setting, which meant community and food service. Some internships may only have like a 4 or 5 week food service rotation. Again, it just depends where you're at and the emphasis of your internship. after you have gotten your bachelor's degree in dietetics or food service or whatnot, and then you complete that 1 to 2 year long internship, then you have to sit for a board examination. And it's a tough board examination. I've taken it. In fact, it's 3 hours. And for someone who gets quite a bit of test anxiety, that was a lot for me. But it is necessary. Obviously, dietitians are, they're dealing with real life patients and making decisions that, you need someone that's educated and has the hands-on experience to be able to make those decisions. So it is a necessary examination. It's 150 questions, and I believe only 125 are actually graded or scored. And then you get a final score and they tell you if you have passed or not, which is probably one of the most nerve-wracking things I have ever experienced. There's a lot writing on that test, and really you do work really hard to get up to that point. So, but again, it is necessary. After you've taken that exam, you then earn your RD or RDN credentials. So RD equals registered dietitian, RDN equals registered dietitian nutritionist. That secondary credential with the N option, the nutritionist option, was added because a lot of people recognize the term nutritionist over dietitian. So we wanted to make our roles more widely recognized. And so that's why the Academy added that option. So if you see RD, if you see RDN, it's the same role. The dietitian gets to pick which credential they want to use. I personally use RD. Some of my colleagues use RDN. It doesn't matter. It's up to completely your own personal preference. And then, as with a lot of healthcare, even non-healthcare, career options, they are kind of increasing the amount of education that's required to enter that field, even as a beginner, which I think is great. I think education is a powerful thing. And I think that you, especially for the dietetics realm, you learn a lot in your education and in that real world hands-on experience in your internship. So starting January 1st, 2024, they are requiring that you have to have your master's degree to even sit for that board examination. So you have to complete your bachelor's degree, your internship, which will probably be done at the same time as your master's degree. So that's 4 years and then 2 years. And then most dietitians take some time off to try and study for that test too, sometimes up to 6 months. So we're talking like almost 6.5 years. And then, post high school, and then you can sit for that exam. But that won't happen until 2024, and all dietitians that are currently credentialed and licensed, they will be grandfathered in. So it's not like if you're a current dietitian, you have to go and get your master's degree. Although, consider the competitiveness that may offer, especially if, you're a dietitian that doesn't have their master's degree and you're considering, doing a job change, still working as a dietitian. But if you're up against other dietitians that have their master's degree, you potentially could be at a disadvantage, but not necessarily. It's just something to think about. So I have my master's degree in sports nutrition, so I don't have to worry about that. But if I were to only have completed my internship, that's definitely something that I would consider, just because, my colleagues and other dietitians will have their master's degree, and I want to be competitive and I want to be educated and knowledgeable and have the tools in my toolbox that I need to be successful. Okay, so that wraps up the first, huge difference between what a dietitian and a nutritionist is. I spent probably 30 seconds on the education required for a nutritionist or lack thereof, and went on, extensively to what the education required is for a dietitian. I do want to add too, that doesn't mean that any nutritionist you meet on the street is uneducated. Absolutely not. There are plenty of nutritionists that are. In fact, there's a lot of, master's level exercise professionals that, get their nutrition certification on top of being a credentialed exercise professional, because they do want to be able to talk about the nutrition implications and things like that, because there are some fundamental, things that you need to know about what you eat if you are also exercising, or say you're on a weight loss journey or a healthy lifestyle journey. Certainly that exercise professional can provide some tips, and having that nutrition certification can, increase their skill set and have some more tools in their toolbox if they don't readily have a dietitian to refer their clients or their patients to. All right, let's move on to the second fundamental difference between a dietitian and a nutritionist, and that's going to be licensing. So obviously, as a dietitian, as someone who, practices in the healthcare setting, is responsible for patients, has to most of the time do documentation, you do have to be licensed, just like OTs have to be licensed, PTs have to be licensed, athletic trainers have to be licensed, and you do have to keep up to date on that, or you can get yourself into some trouble, which we'll talk about. So for dietitian licensing, some states do actually require you to actively be licensed to practice medical nutrition therapy, which dietitians are the only people that can practice medical nutrition therapy. And that is essentially treatment or, providing some complementary care to medical treatment for chronic disease status, diabetes, kidney disease, liver disease, all of that good stuff. And some states also require you to be licensed to even call yourself a registered dietitian. It's not a lot of states, but just, be aware of that. If you are seeing someone that calls themselves a registered dietitian, they're probably also licensed, and you can see that reflected on their credentials after their name. So on top of having RD or RDN, they will also have LD, licensed dietitian. I think some people use the term LDN too. So you may also see that licensed dietitian nutritionist. Licensure for a dietitian does have to be updated every 2 years. You have to pay a fee for that. And some states actually require you to do some continuing education, which you have to do to maintain your RD credentials. So I'm licensed in 2 states. I'm licensed in Missouri and Kansas, and that's because I live in Missouri and I work in Kansas. And I actually see a lot of people in my Kansas clinic that are from Missouri. So it's important for me to have both since I'm right on that state border. For my Missouri license, I do not have to have any continuing education. I just have to re-up my license and pay that fee every 2 years. For my license in Kansas, I have to pay a fee, re-up my license, and I also have to do some continuing education, which, that can sound tedious and annoying for some, but I love learning. I'm definitely a lifelong learner, and I also want to provide the best care for my patients. And I think that having, a governing body or a governing entity that encourages that is important, and I like being a part of that. So you may not, but I do. In terms of being a licensed professional, there's also governing bodies that oversee licensing. So Missouri has one, Kansas has one, each state has their own, and they're usually based out of where your capital is. So in Missouri, ours is Jefferson City. And they basically make sure that if you're practicing as a dietitian, you're also licensed, because you need to be kept accountable to keep up to date in your scope of practice, in your knowledge, and in your responsibility to, renew your license. We're adults. We can do that on our own, but sometimes, we may need some help. And in Missouri, actually, if you're practicing unlicensed, simply if you forget to pay that fee, then you can actually be taken to court and be put on trial for a Class A misdemeanor, which I think means jail time. You might have to correct me on that, but I'm sure you probably won't, because there's people doing worse things in your state. But it's a serious thing. And, our governing body for dietitians takes that seriously. And that's outlined in the state of Missouri through the Dietitian Practice Act. So definitely stay up to your license if you're a dietitian listening to this. Okay, so let's talk about licensing for a nutritionist. If you couldn't already tell with the education piece, the licensing piece is going to be similar. There is no licensing. You're not a healthcare practitioner. You're not probably actively seeking patients. I don't know any hospitals or big entities that hire nutritionists over dietitians. which is good because there's a lot of regulation and licensing, again, that, we as dietitians have to go through. So there's none, and there's really no governing body that oversees like the certification that you have in nutrition. So you don't really know, what you're getting into as a patient or a client if you're seeking nutrition advice from a nutritionist. So just keep that in mind. All right, we're going to move on to number 3, which is additional education. And I use the term education lightly. It's not necessarily formal education, but there's continuing education that can be encouraged on both sides. So let's start with a dietitian. For just renewing like your credential for being a registered dietitian, which you have to do every 5 years. You also have to have a certain amount of continuing education units, CEUs, to actually like be considered eligible to renew your credential. So if you haven't done that by your 5-year period, you better get on it, or else you're not going to be able to re-up that credential. So what's required is 75 CEUs each recertification period. There are so many different things that can count towards your CEUs. Specialty certification. So this recertification period for me, I have sat for my specialty credential in sports dietetics. I'm a board certified specialist in sports dietetics. We'll have to talk about that more later in a different podcast, but there's a whole different process in terms of being able to get that credential and things like that. But if you specialize in a certain area, there are options to kind of get a certification that matches that. So that counts. That actually counts for all of your CEUs, all 75. Master's level courses or other courses taken through accredited universities can count. Lectures, webinars, if you do research, sometimes reading research and doing kind of like self-paced stuff can count as well. But essentially, one CEU is about an hour of continuing education. So 75 hours adds up. That's a lot to have to do if you wait till, the last 3 months of your recertification period, which can happen. I know that there are dietitians out there and even healthcare professionals in other settings that have waited until that very, very last window to get that in. And it can be very time consuming. And it's for a purpose, It's not just to mark it off, check it off before you recertify. It really is to make sure that you stay, up to date on all the things that you need to stay up to date on in your field. So it's not just to make you moan and groan. It's to help, keep you learning and truly keep you practicing in your profession. So there's a reason. And, additionally too, in healthcare in general, especially in nutrition, things are always changing. We have different nutrition recommendations now than we did even 5 years ago, 10 years ago, especially 30 years ago. So it is important to continue to, dive into that research and just understand what's changing, why, and making those changes to your patient or your client care as well. Additional education for nutritionists is, to me, a big question mark. I'm sure there are certification entities that do require continuing education, which I think is awesome, especially if they're pointing you in directions of validated research, organizations that provide very, specific in terms of your certain like area of work. I'm thinking like for me, it's sports. So I have governing bodies that I can turn to for my continuing education, even if they're not directly through the academy or other governing bodies for dietitians. So I'm assuming some certifications may require you to do CEUs, but there's some that, you can study for a hot minute and then you can take that test and maybe you never even have to recertify. Maybe that just stays there. And I'm a dietitian. I specialize in nutrition and I don't even know all of the options out there. So I can't imagine the struggle of, a client trying to find a nutritionist that, is up to date on their research and is actually providing good, credible information. So again, just be wary. Those things differ and there may or may not be, different requirements for making sure that healthcare professional or that person stays up to date on their knowledge and on their research. All right, let's move into number 4 for the fourth fundamental difference between a dietitian and nutritionist. This one I think is really, really important because it truly is a protection of patient and client care, and it's the code of ethics. I don't know, if you're not healthcare based, you may not care about ethics. Maybe there's, ethical guidelines in other areas that are non-healthcare related. That's just my own ignorance, not really knowing what that looks like. But being bound to a code of ethics makes sure that our patients and our clients are receiving ethical care. They are not being put in harm's way. They can ensure that the person that is helping them has their best interest in mind. And you know what? Sometimes that doesn't happen with people who are not bound to a code of ethics. I'm thinking, health coaches that started their own protein bar line, or maybe chiropractic agencies that have their own brand of supplements that they make a boatload of money on. All of those things are conflicts of interest, and not to say that they didn't take the steps necessary to make sure that they're not going to invoke harm on patients, but there's risk there, and you are lessening your risk severely, significantly, if you are seeing someone who is licensed, who is registered, who takes an oath to their code of ethics, and who takes their role seriously and the care that they provide to their patients seriously. And nutritionists are not bound to a code of ethics. No ma'am, no way. They're just not. And in my opinion, you're putting yourself at risk seeking help from someone. And in fact, there has been harm done to patient care, to client care, because they sought out the help of someone who was not adequately knowledgeable about the topic that they were educating and providing treatment for their client or patient. I'm being severe and dramatic because those things, may happen few and far between, but they should be prevented. And making sure that you as a consumer are doing your research and making sure that the practitioner that you're seeking help from, whether that be a dietitian, a doctor, a clinic, a health coach, a trainer, whatever it is, do your research, advocate for yourself. If you have something specific that you need help with, go to someone who specializes in it, because you can be darn sure that they're going to have experience helping people successfully, and they're not going to have invoked harm on previous patients or clients that they've worked with. And you should be worried about that as a consumer. I know it seems funny because you just assume the best in people, and hey, you've worked well with other people, or my aunt or my friend that went to you, but that doesn't mean that necessarily ensures safe care for you. So do your research and make sure that you're seeing someone that's bound to an ethical code, and not that person is unethical if they aren't bound to an ethical code, but you can be 100% sure that someone who is licensed and has a regulating body for code of ethics will be ethical. And that's the gold standard. That's what we want. All right, we're going to wrap it up with the fifth and final fundamental difference between a dietitian and a nutritionist. And we've kind of hinted on this already, especially in the last one with code of ethics, but that's your standards of care and your scope of practice. So I've just transitioned into a new role in my career as a dietitian, and that area is in sports dietetics, and I have my master's degree in it. It's not just a general master's degree, it's a master's in sports nutrition, and I also have my specialty certification in it. And I've recently oriented with a bunch of awesome, fantastic dietitians that are in different specialty areas: oncology, transplant, renal and liver, inpatient dietitians that see a plethora of different things. And it's important to seek care from someone who kind of specializes in that scope of practice, because I don't really know nutrition recommendations that are important to hit on and specify for the cancer population, for the liver transplant population. Could I do my best? Yeah. Was I educated in it once? Yeah. But that's just not where my brain is at. And a dietitian who is specializing in liver and renal, is specializing in oncology, can provide much, much better and efficient care than I can. And vice versa. We had a lot of questions going back and forth with some of their clients who were interested in sports nutrition, post-transplant or post cancer treatment and things like that. And they didn't know the answer to them, or maybe they could find it, but it wasn't efficient. And so they have me on their team to be able to give them those answers efficiently. I don't even know where to begin with scope of practice with nutritionists. I honestly think if you're trying to take the easy way out and getting a simple nutrition certification, you're probably not really worried about standards of care and scope of practice. In fact, I've seen a lot of nutritionists that have tapped into the medical nutrition therapy part, which they're not allowed to in any state. Only dietitians can do that. But I have seen them tap into that, which is going out of their scope of practice, going out of their standards of care. But again, it stems from, what are their standards of care? What is their scope of practice? It's not really defined because we don't really know, what this specific allowance of things you're allowed to say as a nutritionist is. So again, a big question mark. So let me kind of bring it back and kind of summarize the things that we talked about, because my point here is to not bash nutritionists. My point here is to not elevate dietitians. My point here is, just to kind of explain, what I do as a dietitian, what's required of me to get to this point, what's required of me to continue to be a dietitian, and then vice versa, with those who are not dietitians but are trying to intervene with nutritional care. And honestly, we don't really see this a lot in the chronic disease management standpoint, but we do see this a lot in the wellness and the healthy population, which is a lot of who I work with. And I've seen some unfortunate realities of, more mentally harmful things that have happened to clients that have sought the help from someone who is unlicensed, who is unregulated. And that just hurts my heart, because I do see a lot of patients that, are put on these programs with health coaches or nutritionists or what have you, that are required to take in a really low amount of calories that honestly is fit for a toddler. And you think I'm joking, but I'm not. 1,200 calories, 1,000 calories, 900 calories, that is for an infant, not an adult, especially if you are exercising on top of that. I've seen, encouragement of strict food journaling, like anything that you put in your mouth, you have to put in MyFitnessPal or another calorie tracking app. And that's not to demonize calorie tracking apps. It's just to say you can be a healthy human and be successful in meeting your goals without being so OCD about tracking everything that you put in your body. And what we do know is that can actually really put someone at risk for development of an eating disorder. And, my lens is kind of on that population, because I see that a lot in the sports world, in the active population. And a lot of people, unbeknownst to them, kind of formulated disordered eating tendencies or full-blown eating disorders because they were encouraged to be so strict and to watch everything so carefully and so closely to, reach the goals that they had outlined that they wanted for a program, for the person that they were working with, or whatever it is. So, just be aware that those things can happen, and dietitians like myself are trained to invoke, help and create resources that are going to help in your longevity of your health. Whereas those who are not given the formal education and encouraged to do, continuing education and stay up to date on their counseling style or their knowledge, and tools in their toolbox and things like that. I mean, they can really create some unfortunate outcomes. And I do see those people in my office and have seen them since I started practicing as a dietitian. So do your research as a consumer. Don't let this scare you. If you just need some general healthy lifestyle tips, Joe Schmoke and on the corner of 3rd Street can help you with that. But if you're really trying to hone in, make a lifestyle change, manage disease, on top of seeing, a healthcare professional, please reach out to someone who knows what they're doing and is credentialed and is licensed, because you will probably receive results more efficiently and you will not have any harm invoked on you, whether that be mental or physical harm. Well, we did it. We got through our first podcast. I am so excited to be on this platform because I am frankly just fed up with the nonsense that is out there on social media, on apps, on, other platforms. And I am ready to put some credible, awesome, fun, encouraging information out there. And I want to be as transparent as possible. I truly love what I do, and I absolutely enjoy helping people reach outcomes that they may have never understood that, their bodies could achieve, or maybe there's this reoccurring issue that they've had for a long time and there's a big question mark around how to intervene in their health to create a good outcome. And a lot of times that boils down to nutrition. Not always, and usually there's, some co-occurring things that need to be addressed. But nutrition, and I'm biased because nutrition is my area, but nutrition plays into everything. So, we are going to have a fun journey ahead of us. We're going to talk about all the things. I'm also a personal trainer. And like I said, I work with the sports and active people population. So I do talk about exercise as well. I also do have experience doing podcasts previously, but now I am on my own. I'm sole. I'll probably want to have guests on here at some point. So, hey, if you're a dietitian and you're interested in that, let me know. If you're an exercise professional, let me know. But I'm really excited for this journey. I've been wanting to do this for a while. And we'll see where it takes us. So thank you so much for tuning in to the Sporty Dietitian podcast. And I look forward to talking with you next time.